Hello everyone. Welcome to DHN's exclusive session with Dr. Sushil Kumar Meher. Dr. Sushil has been at the forefront of healthcare technology for the past 3 decades, leading the health IT group at AIIMS, New Delhi. His visionary approach has been instrumental in propelling AIIMS into a new era of digital healthcare. In this session, we'll discuss Aayushman Bharat Health Account, Scan and Share Facility. The Ministry of Health and Family Welfare launched the Aayushman Bharat Digital Mission in September of 2021 to provide all citizens with a unique 14-digit digital ABHA ID that would help with easier and simpler accessibility to their medical records and significantly reduce the waiting time at the OPD. All this with a quick QR code scan. More than 1 crore OPD tokens have been generated so far, utilizing the ABHA within 1 year of its implementation, with AIIMS being at its forefront. So, welcome, sir, and thank you for joining.
Okay, thank you for inviting for such a wonderful session, and it is a very wonderful topic also. Yeah, and ABHA is playing a major role in healthcare, not only the government sector as well as in the private sector also. And it is a much weighted one systems is required to the society, or you can say in India, that is that a citizen is supposed to have a single medical records, and it's supposed to be available to all the service provider at any time, any moment, anywhere. Uh, that's why ABHA is so popular and so useful to the all the peoples those who are involved in this. Yeah, over to you.
Yes, sir. So, AIIMS-Delhi has made remarkable progress in digitalizing healthcare services. So, can you share the impact of this transformative initiative on patient care and efficiency at the OPD, especially at AIIMS?
Yeah, of course. Yeah. See, why this ABHA has come up? Let me explain about you. Uh, in the country which needed a single health ID, uh, and they have planned that health records to be available at any time, anywhere, any places, whenever it is need is required by the patient as well as the service provider. But initially they have started 2005, and they have made a standards. It is been initiated by Ministry of IT, and the documents which whatever it has come up, it does not serve the purpose that to make a single health ID for each citizens. Then 2009 again they have started, but it was started by the Ministry of Health. Okay, and they made some draft documents. Again, they found that this is not sufficient, that how the record will be interoperable. That's why they have gone for another series of discussions, meetings, lot of efforts has been taken. Then they divided two documents. One is the EHR documents, another one is the MDDS documents, metadata and dataset documents. In EHR documents, it is clearly defined that how the record is supposed to be and where it will be stored and how it will be accessed. But there is some confidentiality and security issues who are there, which has not been addressed properly. Then what it happens, they again another version of EHR has come up, and they have put it that 2,701 security guidelines or international guidelines, but it does not solve the purpose of the confidentiality and security of health records. So they have thought that this is not the way to do it, because there two factors are there, that accessibility and confidentiality and security. Another part is it has come up that where the record will be stored, and storing a centralized base, it is a big challenge. So in 2017 and 18, then ABHA has come up. That the concept is that the record where it is there, it will be lay there, but it can be accessible by the users with authentication, so that the centralized storing space is not required right now. So they have defined different blocks. Who will get the ABHA ID? The citizens who need the health services. The health service provider means each hospital or each clinics, each path labs, each those who are giving health services in different forms, they need a ABHA ID. If we talk about AIIMS, AIIMS is a institution which is giving the health service provided, health service is giving it. AIIMS has a one single ID. Okay, if I need a healthcare services as a patient, I need a one ABHA ID. If I am a doctor, I need health services as well as I have to provide health services also. So a single ID it can be used, but it will be a number that ID will be little bit changed. You are patient as well as you are health service provider. So they have defined it different blocks. Health service providers supposed to have ID. Health service means those who are doctors, nurses. Then the peoples, those who are giving the other services like physiotherapist. So everybody they need a single ID for that. And when the patient will come, that each services who has given it, it will be appear because that doctor, nurses, physiotherapists have their ID, it will be attached there. So when a hospital is totally ABHA compliance, then the institution supposed to be ID, all the service care providers supposed to have ID, and patient is supposed to have a ID, so that the transparency can be maintained, that that patient has got treatment from who has prescribed what medicines, who has prescribed what test has to be performed, who has done the test, so that all the transparency was supposed to be maintained. And it was a wonderful thought, a wonderful idea, and you can say a wonderful decision has been taken by the government of India, which is very practical and which can be very useful. Come to your questions. What you have asked me that AIIMS, what is doing it? See, we are getting around 14,000 patients in the OPD, and each patient has to be registered. Out of 14,000 patients, around 60% is revisit, and around 40% is new patients. Those who have already registered ABHA, there is not a problem. Those who are not registered in the ABHA ID, so what we have done it, in the OPD area, we have put QR codes. Okay, those who have the smartphone, they are not required to go to the counter for registration. They have to scan the QR code, and the process will start. If the QR code you have started, when you will give your all the demographic details with the if you have ABHA ID, you can give it. If you do not have ABHA ID, then it will ask you the Aadhaar. So automatically it will authenticate from Aadhaar. The OPD will be generated. When we give the OPD, automatically the ABHA ID will be created. After creating the ABHA ID, same demographic details, it will register in our e-hospital of AIIMS and generate a AIIMS ID, AIIMS OPD number. So it is a seamless, and it is not required to go to a place to do multiple things. This is single sign-on, it can be done. Second part is that when you will do a, let's say you do not have the ABHA ID and do not have a mobile, you can go to the counters and same activity can be done. If you have mobile but internet is not there, so AIIMS is providing Wi-Fi in the OPD areas. They can do all these things from their mobile if internet is not available. So it is totally a smooth and very easy to operate it. So this is the one of the advantage which is been available in the AIIMS. The patient are getting the registrations without any hassles.
Great, sir. Thank you so much. Definitely, ABHA has simplified this OPD registration process and significantly reduced the waiting time as well. Also, has improved the accessibility for everyone to access their medical records easily. So, thank you so much, and your insights have truly enriched our discussion. In the next episode, we'll discuss about artificial intelligence and its role in improving patient care and outcomes. So, thank you so much for joining, sir. Thank you.
Okay, thank you. Thank you.